And then Chris, you can go ahead and take control.
So I think we're going to go ahead and get started, everyone on the phone. Good afternoon, and thank you for joining us today for our webinar, Telehealth 101, What You Need to Know to Get Started. My name is Chris Dare, and today's webinar will be jointly presented by Beacon Health Options and our colleagues from the California Telehealth Resource Center. This webinar is being done specifically for our Beacon providers in the state of Mass. Mass is our home state. Beacon is headquartered in the heart of Boston. On the call with me from Beacon are Jose Aponte, who leads Beacon Telehealth Initiative, and Amy Perlman, our VP of Clinical Provider Strategy. Kathy Chorbra and Rebecca Picasso are on from the California Telehealth Resource Center, and also joining us are Danielle Lauder and Reed Plimpton from the Northeast Telehealth Resource Center. I think we have all our bases covered. On behalf of Beacon Health Options, we want to thank each of you for all you are doing to provide care to our members during this unprecedented time. Everyone has done a great job pivoting and adapting to the needs of our shared members. One thing I also wanted to add is once you've set up your telehealth, I strongly encourage you to reach out to your clients and members to let them know telehealth is available. We've had a lot of reports from our providers saying call volume is down. Some of our member services have reported call volume down. And we think the issue is that providers don't realize that they can receive services safely from their home. So once you've established your telehealth services, please reach out to them and connect with them and let them know that you're doing telehealth. So our objective today is to support our providers as they shift to telehealth in order to serve our members. With stay-at-home orders in place for most states, we want to support any means necessary for our providers to continue to serve members. Today, we're going to cover Beacon's position on expanding access via telehealth, how telehealth enables continuous care during COVID-19, implementing telehealth, which includes platforms, etiquette, and HIPAA compliance. We'll also discuss technology options and best practices. We'll suggest additional resources for providers from both Beacon and the National Telehealth Resource Center. Also, Beacon will be conducting additional, more specific webinars in the next few weeks, and we'll send each of you an invite for that as well. And just to clarify, our purpose today is to educate providers on how to do telehealth. Telephone services are allowed, but the webinar is focused on telehealth. And the reason we're doing this is we want to encourage providers to establish practices that will create a sustainable telehealth model that can be used after the pandemic has passed. A few housekeeping items. Today's webinar will be 1 hour, and that includes a Q&A section at the end. Due to the large number of participants, attendees will be muted during the webinar. So please don't use the chat function. We have enabled the Q&A function so that you can ask questions. We're going to monitor those questions throughout the webinar, and we're going to answer as many questions as possible at the end. This webinar is being recorded, and we'll post it on our website within 24 hours after this. I'm now going to turn it over to Amy Perlman.
Hello, everyone. Thank you for joining us today. Can we move to the next slide, Barry? I wanted to speak to you all about Beacon and MBHP's position on telehealth. I think that many people on the call are aware of this already, but what we're really doing here is trying to focus on continuity of care and access to care for individuals in terms of their mental health needs during the public health emergency. Telehealth is something that Beacon has been in support of prior to COVID, but it's become that much more important, as my colleague Chris has mentioned as well. So I think what we are looking at here is that we are covering telehealth services, including telephone and live video, to support members accessing clinically appropriate, medically necessary covered services. So we are encouraging providers to use technology to communicate with individuals in a confidential and secure manner. And if you have questions about any particular services, we've got some numbers here for you to contact as well. And I think similar to what Chris was saying, as much as we would like you to let your clients know if you are moving to a telehealth platform, we also encourage you to let the folks at Beacon know, either through our provider relations or our provider quality teams. We'd like to make that available to individuals and families who may be calling Beacon and looking for referrals to needed services as well. Next slide. I am hoping that this won't be new information to all of you, but the Massachusetts requirements for telehealth include consent as a priority. We are looking for identification and authentication for patients, looking to understand that the member or the individual or family can know that they are speaking to a provider and can verify your identity and credentials, but also that you know who it is that you're speaking to as well. So you want to let individuals know where you are, but also obtain the location of the patient. And that may be a conversation we have in further trainings around crisis planning as well over the virtual platform. So we are also asking that individuals and practices identify a process for emergency services and how they may let individuals know how they could access an in-person clinician in the event of an emergency, or if that is something that is necessary. Move to the next slide. We want to be supportive of confidentiality, as we always would be, with behavioral health services. So to the extent that that is feasible during the public health emergency, we want you to use your policies that you would use in face-to-face services and inform members if there are any concerns around confidentiality over the virtual platform. We expect that you would be reviewing the medical history with a new patient and any available information before you would initiate service. And we would also want you to be reviewing all collateral information as well for individuals as they are, even if they have an existing relationship but with the provider. Next slide. I think I will hand off to our colleagues from the Telehealth Resource Center.
Hi, everybody. My name is Rebecca Picasso, and I'm the Program Director for the California Telehealth Resource Center. So just real quick before I dive into this, a little background on who the CTRC is and who the National Consortium of Telehealth Resource Centers are. CTRC was established as a federally designated telehealth resource center in 2006. We are one of 14 resource centers across the country. There are 12 regional and 2 national. And as Chris mentioned earlier, your telehealth resource center that covers Massachusetts, it's on the Northeast Telehealth Resource Center. And if I can advance my slides, there we go. So just as a little disclaimer, portions of the information in these slides have been provided in part by other telehealth resource centers. The information is, of course, used with permission from each of these TRCs. So what is this part of the presentation and what isn't it? So this presentation right now is for providers who wish to implement web-based video to interact with their patients during the pandemic. Under normal circumstances, the resource centers would, of course, recommend that you go through a pretty intensive implementation and development process where you go through an in-depth needs assessment and figure out what you want to do, what equipment you need, all that good stuff. We're not going to do that today. Today, we're just going to focus on web-based. So we're not going to cover other types of telehealth, such as store and forward or remote patient monitoring. We're also not going to cover a great deal of the telehealth technologies that are out there, such as telemedicine cards or medical peripherals. We're simply going to focus on web-based. So let's talk really quick about the telehealth landscape. So in general, there are a lot of drivers for telehealth, and there are also still quite a few barriers. Right now, obviously, the big driver is the public health emergency, and a lot of those barriers have been removed. So your governor has issued an executive order that is requiring carriers to allow in-network providers to offer telehealth. Mass Health Bulletin stated that providers are permitted to provide clinically appropriate medically necessary services via live video or telephone, and that there are no technology requirements, and that managed care entities are required to cover telehealth services. So there's a big push right now to remove as many barriers as possible so that you can see your patients during this pandemic. All right, let's get into the good stuff. Let's talk about software and equipment. What do I really need to get started right now? So in general, it is a good idea to take a long look at technology and what kind of technology you want to use. However, right now, the federal government, your states, all of that, they're providing all kinds of flexibility in the types of equipment and the types of software that you can use. A lot of the vendors out there are providing free or reduced cost platforms and technology in order to support the quick ramp up of telehealth services. So this slide here is just talking about some of the off-the-shelf products that you can use to provide telehealth services. So you can use a desktop with an external webcam. You could use a tablet. You could use a cell phone. You could use a laptop with an internal webcam. You don't have to go out and purchase expensive devices and whatnot. You know, if you have any of these things that you're able to utilize, absolutely you can utilize them for web-based live video services. One little note here, camera stability. If you're going to use a mobile device, you're going to use a tablet, or you're going to use a cell phone, please make sure that you use a stand or a mount or something that will keep the device still. You don't want to be walking around talking to your patients and pacing in your office or up and down the hall, or because it starts to get a little motion sicknessy when you're doing that. And vice versa for your patients. If your patients are on some kind of mobile device, you might want to ask them to consider using a stand or a mount or something to keep that device still so that you all can see each other as easily as possible. Video platforms. So in general, and always, the telehealth resource centers across the nation will always recommend that you utilize a HIPAA-compliant software platform, one that provides a BAA, one that enables you to password protect your sessions and restrict the sessions to only people that have been invited and things such as that. However, right now, the Office of Civil Rights has temporarily relaxed their enforcement standards during the public health emergency and are allowing the use of non-HIPAA compliant platforms such as FaceTime, Skype. I've even heard of Facebook Messenger. Again, Beacon and the telehealth resource centers across the nation do not recommend that. It takes just as much time for you to utilize a HIPAA compliant secure platform as it does for you to use one of these non-HIPAA compliant platforms. So please, wherever possible, utilize one of those HIPAA compliant platforms. And what are those? So there are hundreds out there right now. Some of the most common that we see are things like Zoom for Healthcare, VC, Doxy.me. They're all out there. All of these on this slide absolutely have a HIPAA compliant platform. They offer a BAA, they offer waiting room capabilities, they offer all the stuff that you need in order to do this as securely as possible. If you have an EHR or a practice management system that has live video already integrated in that, you are welcome to use that as well. No need to go out and spend money and purchase a video platform if you've already got it available to you. All right, some direct-to-consumer considerations. So most of you probably haven't seen your clients in their home before. So seeing clients in the home is perfectly fine, but there's some things that you want to keep in mind that are potential risks. So you're going to lose any physical control of the patient and their surroundings. You are going to be relying on their equipment and their network, whether it be cellular, Wi-Fi, whatever it is. You're going to be relying on their equipment and their network, and you have no control if they can't, join with you or if they're having technical difficulties. And you may need to verify the patient's location for safety reasons. If you need to send emergency personnel to where the patient is, you want to make sure that you know where they're physically located at the time that you're seeing them over video. There isn't necessarily any one correct solution to these risks, and it may be impossible for you to provide appropriate treatment in some locations. So just keep that in mind. All right, we come into the demonstration portion of today. So I'm going to turn on my webcam for you guys, and hopefully everybody can see me. So we're going to talk about creating the illusion of eye contact and how we do that and what that looks like. So to create the illusion of eye contact, the first thing that we're going to do is we're going to start with where our camera is placed. So in this instance, it's where the red circle just showed up above the dock here. This is kind of representative of a laptop, but the principle is still the same whether you're using external or internal cameras. So you want your camera to kind of be placed right about hairline, maybe even top of forehead, somewhere in this general region. And you want to make sure that your face is located directly center in front of that camera. And I'm going to show you why. Because if I move my camera, excuse me for just a second, if I move my camera 6 inches to the left or 6 inches to the right, I'm still looking at the exact same place on my screen, but now it no longer looks like I'm looking at you because I'm not. Most of us aren't going to focus on looking at the little hole for our camera when we're talking to patients. We're going to be looking at our screen and looking at the patient. So keeping your camera center helps create that illusion of eye contact. Again, having your camera kind of situated physically about right here or so. And then you also want to make sure that your camera is high enough up. So again, a little demonstration, please excuse the moving of my camera. But if your camera's way down here, it's not a very professional look, and you're definitely not going to be creating eye contact at all because I'm looking at my screen. I'm not actually looking at my camera. And so if you find that your camera is too low, whether you're using external or whether you're using internal, raise it up if you can. If you're using a laptop, don't set the laptop on your lap. Actually set the laptop on a surface, a desk. If that's still too low, put some books underneath of it. Put a box underneath of it. Put anything underneath of it to raise your camera up so that it's almost head on. It could be a little bit higher, right? We all want those good angles to make us look good. But in general, you want to make sure that your camera is high enough so that it produces the illusion of eye contact. One last thing to help, sometimes if you're too close to the camera, it doesn't give that illusion of eye contact. So I'm going to kind of scoot in here, and as I scoot in, I'm looking at the middle of my screen, but it doesn't look like I'm looking at you at all because I'm not. But if I just back my chair up just a little bit, I can pretty much look anywhere on my screen, and it basically gives the illusion of eye contact. It's not going to be perfect. We're all working from home. We're all getting used to all of this. And so it'll take some practice. But those are some ways to create the illusion of eye contact. And there it goes. Let's talk about lighting. So still going to demo here for you. So right now I've got some pretty decent lighting going on. I do have some overhead lights and some stuff. So we're gonna talk about the different types of lighting. So in general, we're in the workplace. That lighting is often good enough. It usually, works well enough. Everybody can kind of see you. But most of us are working from home. And so we all have different lighting situations that we never even realized. So the general principle for lighting is you want to make sure that you use bright, diffused light from the front. So what that means is that you want the light to be behind your camera, pointing at you, but you don't want it to be a spotlight. You don't want like a flashlight. You want it to kind of, just be a general nice little light that kind of envelops you in a glow. So let me show you what that looks like. So I currently have a ring light in my office. If you're not familiar with what a ring light is, if you have a teenager, they probably have one. They use them for selfies. They work great for video. So I'm going to turn my ring light off so you can see what it looks like. So I just have an overhead light on right now. When I turn my ring light off, the light from behind me and above me is kind of backlighting me. So I'm very shadowed right now. And that's not a very good look when you're trying to talk to patients and and create that rapport and whatnot. So having the light from the front, just kind of a decently bright, diffused light works really well. If you don't have a ring light, and that's okay, I'm going to turn this off again and show you something else. You can also use lamps, but you want to make sure that if you use lamps, that you use more than one. And here's why. I have a lamp over here to the right of me, and I'm going to turn it on, and it created some light, but it left this side of my face over here shadowed, and it created a light source from over here. And honestly, this lamp is not bright enough. So I'm going to turn this back off, and I'm going to turn this back on here. So if you're going to use lamps, as much as possible, again, kind of either to the side of your camera or just right behind your camera, put two if you can. One on the right, one on the left. That'll create two light sources coming from both sides and should remove those shadows. Keep in mind that lampshades can throw shadows that you didn't even know existed. If you have a stripy lampshade, sometimes it can look like those old 80s photos where we all look like we had blinds behind us. Keep in mind too that if you have windows, windows with blinds can throw shadows that look funny. So the best practice there with windows is to keep windows in front of you or to the sides of you. You don't want a window behind you because that will backlight you again. It will bring light from behind you and push it forward towards your camera, and that'll create the shadows. So if you also have curtains, curtains are great. Blinds are okay too. It's not that you have to go out and buy anything, but just as best as you can, you want to try to avoid those funky shadows. If you have any bright or reflective backgrounds, so if you have some tie-dye rug on the wall back behind you, probably not the best thing to have when you're on video with your patients. Just your general office is fine, you know, just things to keep in mind. So I'm going to go ahead and turn off my camera because that ends the demonstration portion here. And now we're going to talk about privacy and security. So generally, when you're in the office, you're probably in a location where people aren't walking through. They're not, you know, you're probably in some kind of room with a door, hopefully. So you want to make sure when you're at home that the same thing applies. You don't want to be doing these visits from your kitchen with your family walking around, or you don't, you know, want to be doing these in any kind of place where there's traffic, right? You want it to be private, so preferably a room with a door. If you are in an office and you have glass windows, make sure that those are covered still, because you don't want, you know, family, anybody else peeking in and looking and seeing what you're doing. And so that's just kind of a best practice rule of thumb there. Framing and background. So again, you want to keep your camera kind of head level, and you want to fill the frame to the top as much as possible with your body. So either chest up, waist up, depending on your comfort level there, but you want to make sure that your entire head and probably chest is in the video frame. If you're a hand talker, please include your hands. And the reason why is sometimes when you're talking with your hands and it's off camera, patients don't know what it is that you're doing. They don't realize, and they're like, what are they doing? I don't understand. And so if you just scoot yourself back a couple of inches or adjust your camera so that your hands show, that makes it a little bit easier for your patients. Again, you want to avoid any kind of intrusive backgrounds. Don't want that tie-dye rug on the wall behind you. You want something as clean and simple as possible, and you want to avoid backlighting. So you always want that light to come from the front of you, behind your camera, from the front, pointing at you. You do not want that light to come from behind you, pointing towards your camera. Sound is super important and causes a lot of problems for a lot of people. So if you're able to use a headset like I had on, if you saw when I was demonstrating, there's lots and lots of different mic styles available. Use a headset, use an external mic, but choose the one that's the least intrusive. You kind of don't want to use like the big Dre's Beats headphones that, you know, look really cool when you're out and about, but maybe aren't the best for seeing your patients over video. If you're receiving any feedback, so that ear-piercing sound that some people are familiar with, it's usually caused by two audio connections happening in the same room. So to use Zoom as an example, typically when that happens, someone has logged into Zoom and they're using computer audio, and then they've also dialed in via the telephone, and both connections are unmuted. Typically is what we see causing feedback. If you're hearing an echo, it's probably not you causing the problem, because the one that can hear the echo isn't the one causing the problem. So if your patient says, hey, I'm hearing an echo, it's probably you. Pro tip, the mute button is your friend. You know, we're all working from home. It's all uncertain times. We've all got dogs, you know, some of us may have kids at home, you know, it's a different environment. And so if you need to, if there's a knock at your office door and a kid needs something, you know, feel free to say to your patient, excuse me, just 1 second. Hit the mute button and then go take care of what you need to come take care of and come back to your patient. Don't forget to unmute yourself. That kind of helps, you know, your patient not hear any unwanted conversations or background noise or whatnot. But again, you know, be careful when you use the mute button, and just make sure that you are well versed in how to unmute yourself. So some universal video etiquette here. Everybody in the room should be on video, or at least should come on the screen and be introduced. That goes for both the clinician side and the patient side. So if you happen to have somebody in the room with you, bring them on camera, introduce them to the patient, get consent that the patient is okay that you have somebody in the room with you. They understand somebody's going to be in the room, whether they're on camera or off camera. And on the patient side, same thing. Ask your patient, hey, is there anybody in the room with you? And make sure that person comes on video at least to, you know, acknowledge who they are, introduce themselves, and then you can continue. Internet bandwidth considerations are a big deal right now. So successful video visits require that you have adequate bandwidth to not only your home, but also to the device that you're going to be using to see patients. And so while many homes have a decent amount of broadband and they've got great wireless plans, we're all working from home, or we're all doing school from home, or we're all streaming, you know, the latest Netflix craze. And so we're not necessarily prepared for the amount of bandwidth that takes up on your home internet systems. So if you have any other family members in your house that are streaming video or playing video games or even doing online schooling, if you could ask them while you're doing your sessions not to be streaming those things, or to utilize as little internet as possible, that's going to keep your video as crisp and clear as it can, so that you don't have that garbled audio, so that you don't freeze, things like that. Similarly, if you're going to use a laptop or a desktop or even a tablet, close any unnecessary apps or windows. I know I personally like to work with about 30 Google tabs open and I switch back and forth between them. But when you get on video, it's a good idea to probably close as many of those tabs as possible, because those also compete for resources when you're seeing patients. So some tips for success. If possible, complete a pre-test call with your patients. So often in everyday environments, this is probably done by a front office staff or an MA who functions as a super user, or anybody that really could walk patients through the testing process. I don't know if that's available to you right now. If it is, that's great. Keep doing it. If it's not, you might want to consider testing with your patients yourself before you really get into the actual visit itself. Just a quick 5 minutes. Make sure that you can both hear and see each other, that the audio and video on both sides aren't muted or turned off. Again, that if the connection isn't all that great, if somebody's freezing or the audio sounds garbled, that both sides limit anything else that's connected to the bandwidth, close any extra windows or apps, all that kind of good stuff, and help your patients become comfortable with the experience. Keep it simple. Provide a little familiarity with the technology. It really does go a long way, and sometimes that pre-test call can help provide that familiarity. So if your patient's never done a video visit or never had a video chat or anything like that, that little pre-test call can get them more comfortable with it before you actually have your visit. Have a backup plan if your technology doesn't work. Can the call be moved to telephone only, or does the patient maybe need to be seen in person instead? You want to have that decision made in advance and be prepared for that if it happens. And most importantly, guys, relax. Patients tend to enjoy, especially right now when we're all at home and maybe not so socially connected, patients really seem to enjoy connecting with their provider, and telehealth still provides that connection. And so if a provider or a patient has just one bad encounter, they probably need about 10 good encounters to regain trust in the technology and that this is a great service. So just keep that in mind and try to make it as enjoyable of an experience as possible for your patients and yourself. So some best practices for building rapport. Talk normally. Hopefully you're not shy for being on video, and just try to keep in mind that it's very much that you're just talking with your patients. You're using a different medium to do so, but you're just talking with your patients. You're just seeing them very similarly to how you normally would. It just happens to be that you can't be together in person right then. Make sure that you look at the patient. That's going back to that illusion of eye contact, right? So make sure as much as possible that you're looking at your patient. You're not looking at your second screen and charting the whole time, or you're not, constantly looking at your notes and forgetting to look up at your patients. You want to make sure again that you place your self view frame as near the camera as possible. So if you are a person that wants to watch what you're doing while you're talking, and you're going to be looking at that screen, kind of place it up towards the top of your camera. Use gestures and be animated. So if you are a person that talks with your hands, keep talking with your hands. Just make sure to back yourself up from your camera just a little bit. Next slide, please. And now I'm going to turn it back over to Chris with Beacon.
Thank you, Rebecca. Excellent job. I love the camera presentation and demonstration. That was awesome. So reimbursement. This is really why everybody just jumped on the call today most of the time. Don't overthink it. So we're going to cover Beacon and MBHP's billing. Our expectations of services are the equivalent to those that are delivered in the office setting. You're still going to submit your claims in the same format. You'll utilize the appropriate CPT code in concert with the type of service and duration of visit, just like you do currently. The only thing that's really different is you're going to use the place of service code 02 when you submit your claim. It's not required, but we encourage you to use the 95 or GT modifier. That 95 modifier is what lets us know that you're doing live video conferencing. So the modifier is great to put in there, but the only thing that's actually required is that place of service code 02. Reimbursement for your telehealth services is the same amount as your traditional office visit. You can also go back and bill for dates of service all the way back to March 12, 2020. I'm actually going to turn it back over to Kathy of the Telehealth Resource Center.
Thank you, Chris. So if you're asking yourself the question, where can I go to learn more about telehealth? A good place to start is the National Consortium of Telehealth Resource Centers. Hi, I'm Kathy Chorba, the Executive Director of the California Telehealth Resource Center. As Rebecca mentioned earlier, the CTRC, established in 2006, is a member of the National Consortium of Telehealth Resource Centers, which is funded by a grant from HRSA. The map that you're seeing right now shows the 12 resource center regions, as well as the TRC that's responsible for each region. There are also 2 national resource centers, one for policy and the other for technology. We all work independently, dedicated to serving our specific region, but we also work collaboratively so that we can develop resources as a group and distribute any highly specialized expertise nationwide wherever it's needed. As a consortium, we've developed a national website, telehealthresourcecenter.org, and on that website you will find links to all the regional resource centers as well as a wealth of information. The resource documents that you'll find on the national website have been created as a group collaboration using expertise from all of the TRCs. Documents like the COVID-19 Telehealth Toolkit, how patients can engage in telehealth, and HIPAA and telehealth are only 3 of the many documents that are available to you that range from a Telehealth 101 to how to develop and sustain your own telehealth program. In addition to our collaborative efforts to create informational documents, each TRC has contributed resource materials that they have developed independently but can be applied nationwide. On this page, you'll find useful toolkits, checklists, templates, reports, directories, videos, and a bibliography of relevant and published articles. In response to the pandemic, each individual TRC has created a COVID-19 page on the regional website, which features state-specific policy and reimbursement updates, as well as best practices for patient and provider education, workflow, and quick startup guides and checklists for direct-to-consumer telehealth. You can access the Northeast Telehealth Resource Center's COVID-19 page by following the link that's provided on this slide. I'd like to take a minute to highlight the work of the Mid-Atlantic Telehealth Resource Center on their Telebehavioral Health Center of Excellence. If you visit their website, tbhcoe.matrc.org, you will find the most current information dedicated specifically to telebehavioral health. On this site, you'll find a number of video clips that range from the introduction of telehealth to HIPAA compliance as it relates to mental health, as well as reimbursement issues. And then topic-related page links are also provided to get you to where you want to go if you're searching for clinical guidelines, practicing across state lines, financial planning, laws and regulations, technology training, and so much more. The National Consortium also hosts a monthly webinar series that's offered on the 3rd Thursday of each month. Topics there range from policy and reimbursement updates, clinical workflow and best practices, to telehealth program development and sustainability. You can find a listing of the upcoming presentations on the national website. Please take a minute to sign up for notifications and join us on these great monthly webinar series. The next webinar will be really interesting to you all. It will be offered on April 16th, covering COVID-19 and telebehavioral responses across the lifespan. This webinar is going to be presented by our colleagues from the Heartland and Great Plains Telehealth Resource Centers. But if you miss it for some reason, don't worry. We also record and archive all of our webinars so that you can watch them at a time that's most convenient for you. So the key takeaways here are the telehealth environment changes rapidly. We've seen a lot of changes in the past 30 days, and we anticipate more changes to come throughout the year. It's our job to keep up with all the new information so that we can be of better service to you. Visit our website for up-to-date resources and information, and send us an email if you have a specific question, or give us a call if you'd prefer to have a discussion. For those of you who are more of a do-it-yourself type, our webinars are designed to give you all the information, and our websites actually are designed to give you all the information you need to get started and to succeed. And best of all, everything is free to you because we're federally funded, so please take advantage. And finally, because we are a consortium, when you contact your regional resource center, you can do so knowing that they have the power of the national consortium behind them whenever needed. So we'll look forward to connecting with you, and I thank you so much. And back to you, Chris.
All right, thank you very much. So we've actually built out our Beacon webpage even more, and we have plenty of Beacon resources on there for you to go and utilize. And on there, you can find provider FAQs for PHP and telehealth. We actually have some ABA, COVID frequently asked questions. We have business support. We have coronavirus general and mental health FAQs. We have tips for housebound families, finding coronavirus media coverage overwhelming, some kind of tips, social distancing for the social animal, how to navigate anxiety caused by coronavirus, and how to help children navigate anxiety caused by coronavirus. And we also have a section for state-specific guidelines. We're going to be doing, and then please check back to our webpage often. is we're creating other great webinars like crisis planning, compassion fatigue, transitioning IOP and PHP, and navigating billing. We've also included some helpful mass resources. This refers to their government page, and you can check there for the different information that we have. Also, we just want to thank you for joining us. We appreciate the service that you're providing for our members, and I want to encourage you again to please reach out to your members and let them know you're doing telehealth. If you don't call them, they may not know that there's a safe way and a safe environment for them to receive these services, and telehealth is a fantastic way. We've been using telehealth here in my state for many years, and we've had really high provider satisfaction surveys. They really like the convenience, and so just reach out, connect with them, tell them how easy it is to use, and then encourage them to give you a call. I'm sure with all the people stuck inside with their spouses, stuck inside with their children, they could probably use somebody to talk to. This presentation will be posted on the Beacon website within 24 hours. We encourage you to please take our short survey at the end of this presentation. It's only like 3 or 4 questions. It's super easy to do, and we really want to get your feedback, and we want to know what other webinars would be beneficial for you. Once again, thank you all. We're going to do a quick Q&A session. Barry is going to be our moderator, so I'm going to turn it over to you, Barry.
Thank you so much, Chris. This is Barry Castle. I am the manager of provider training here at Beacon. So we're going to go through some of the questions that we've received and address these to members of our panel who are so kind to join us this afternoon. So in regards, there's probably a lot of questions specific, and I know Chris addressed this a little while ago regarding specific billing questions. So because a lot of these can be plan specific, we are preparing additional communications. So, you know, we can't really dive down into specific billing or rate related questions. But what we're going to do is go through some of the ones that would be more applicable to some of the information that we went through today. And it also looks like some questions have been answered along the way. Our first question we see here is Beacon considering waiving extended outpatient authorizations during COVID-19? And is there a best contact number for providers to reach Beacon for assistance with accessing their user accounts if they are unable to access their user accounts for authorization requests? I'll let maybe some of the clinical folks weigh in on this, but in terms of the second part of that question, you want to reach out to the Beacon Massachusetts Provider Services line. So if you're having an issue with, I'm assuming this is your e-services account, in order to submit authorizations or do any other normal transaction that you would normally do, you would want to reach out to our Provider Services line, and they can assist you in that area. Regarding the outpatient authorizations, I don't know if Amy or one of our clinical folks has an answer for that we want to address at this moment in time, or if we're just going to be proceeding in the normal manner that we would normally handle requests.
Sure, this is Amy, and what I would say at this point is that we are not looking to change our authorization procedures for extending outpatient services, and part of this is not because Beacon wants to say no, but because we are really trying to make sure that folks get access to services and that we're able to understand where we may be able to offer care management services or help with resources along the way. So in some instances, we may have conversations with our plan partners around changing authorization requirements, but as a whole, we are really trying to kind of stay connected with you as providers and stay connected with our members and how they're utilizing services.
Great. Our next question is asked, is our regular telephone calls okay? Several of their clients have declined using video calls and asked that they have their sessions on a regular telephone call. Is there a risk regarding this in terms of HIPAA or not being encouraged by Beacon?
Hey, this is Chris. They can do telephone. We want to make sure our members get service in whatever modality possible. You know, we do encourage live video conferencing because we feel like you can make that eye contact, you can really see your patients, but it doesn't matter. If the telephone is the only way that you can do it, that is absolutely fine. Yeah, so it's fine to do the telephone.
And we have a question about how they obtain informed consents or releases during this time. So obviously people would not be coming in in person, is there a best practice that we can answer regarding informed consent releases for members?
This is Amy, and we do not necessarily have something to offer in terms of best practices at this point, but we are gathering information, so I do suggest asking your peers. Some folks have used emailing documents over a secure platform. Some folks have used DocuSign. I think that at this point, we're kind of trying to figure it out with you and would be happy to share resources as we find them on the Beacon website.
And this is Rebecca with the California Telehealth Resource Center, just adding in that we have heard from a lot of our clinicians that they're utilizing services such as DocuSign in order to do that where they need to.
And it seems we had a couple of questions that were similar to about using the phone as well, so I think Amy answered that. But we do have a question about, and I think this would probably be good for our panel to address, about recording the sessions, and I feel like that would probably not be encouraged for a variety of reasons, but I'll let our experts address that.
So this is Rebecca with the California Telehealth Resource Center, and I would love for the Northeast Telehealth Resource Center to pipe in, but we don't ever recommend that you record these sessions at all whatsoever. It is a HIPAA nightmare. Don't do it, don't do it, don't do it.
I would say that Beacon supports that in terms of the logistical, how to protect the confidentiality and privacy of recordings is it's something that I think you would not want to work through in a Telehealth 101. I would recommend avoiding it for the foreseeable future.
Can folks hear me?
Yes.
Yes.
This is Danielle Louder. Sorry, I was having some tech difficulties. I'm literally listening and watching this whole thing on my iPhone because almost all of Maine has zero power or Wi-Fi. So my apologies. The challenges of technology. I would 100% agree with Rebecca and the folks who have mentioned already. Recording of sessions is not advisable. In addition to the HIPAA challenges, think about the storage of those. Even if it's in the cloud, it's a nightmare kind of all the way around. So.
We do have one person who weighed in regarding the consent that some of their colleagues are getting verbal consent and documenting in notes. Would that be sufficient? I know this is an area that we're still working on, but as this provider offered that suggestion, let's see if that meets that standard.
Guys, it's Danielle again. I would just throw in there that several states are allowing for verbal, and they've actually included that language within their emergency orders or executive orders. Whether it be their Medicaid programs, Medicare, try to have a protocol in place. What exactly do you need to collect for that consent? And are there specific requirements within your telehealth policy? For example, here in Maine, there are particular bullet points that you have to include within your consent. So you'd want to make sure that you have a document kind of to follow if you're going to obtain that verbal consent, and then document it on your end.
And we have a question about working from out of state. So if the provider may be working, maybe they're isolating in an area outside of the state that they would normally practice in, are they still able to see their members if they're doing this telephonically, even though they may not be in state?
Danielle again. Massachusetts does have waivers or orders in place, emergency orders that do allow providers from other states to provide those services. They do want folks for Mass Health, I know, for example, they want those providers to submit documentation, a request for an emergency licensure in the state of Massachusetts. And I'm assuming that that's all going pretty quickly because they have that process set up. But they do require some type of documentation submitted.
So Danielle, this is Rebecca with CTRC. Do you know if it's a Massachusetts licensed doctor who's working out of the state seeing Massachusetts patients, if there's an issue with that right now, if they're not physically in the state?
I don't believe there would be an issue with that. It would be like if there's a Maine doc who needed, not a great scenario, I guess, but if there's a physician in Philadelphia that needed to see patients in Massachusetts and they could, they're not licensed in Massachusetts, they could submit for that emergency licensure status and get that, from what I understand, pretty quickly as long as they're in good standing. But if they're already licensed in Massachusetts and they just happen to be located in another state, that should not be an issue.
And we have an interesting question here about if there's any specific resources or maybe best practices for providing care regarding group-based services that providers should be following.
So this is Rebecca with CTRC. I'll answer that really quickly for the resource centers part. So the Telebehavioral Health Center of Excellence through the Mid-Atlantic Telehealth Resource Center has some documentation on that. So you can find some clinical guidelines there.
Yep, and there are certain video conferencing platforms, and if folks have questions about it, you can certainly reach out to our team, to Rebecca's team, et cetera, that are better equipped for group visits. So thinking ahead to can folks join via audio only if they don't have access to audio and video? For example, Zoom is a platform that would allow for that, but some platforms don't. So just, kind of reach out to us if you have questions about which ones would and which ones wouldn't accommodate group sessions.
And we have a question about the modifier. I know Beacon's just requiring the place of service code at minimum, but is there a difference between the 95 and the G? What is the difference between using the 95 and GT modifiers?
So this is Rebecca with CTRC. In general, there's not a huge difference. They're both live video modifiers. I'm not quite sure why we switched from GT to 95, but it happened, and I've yet to be able to figure out the difference, but they are both live video modifiers.
Yeah, and both of them honestly are a little bit like Medicare before COVID-19 had actually stopped using those modifiers in 2017, and before that, then it was GT modifier, then it was 95, and then they stopped using 95 and they went to place of service 02, and now of course they're asking you to use your regular place of service plus 95 for Medicare. So yeah, there may have been years ago a distinction between the two, but particularly when it comes to commercial payers, it's really the preference. So know which commercial payer you're working with and which one they're requiring. Main care still requires the GT modifier, so it varies.
So this is Ryan Wilkie with Beacon, and just wanted to inform everybody that per the Mass Health Guidance 289, they do require place of service 02 to be billed for telehealth services. We will accept the GT modifier and modifier 95, but we are recommending that everybody bills with the place of service 02, and it is required for Mass Health members.
And as a follow-up to the modifier, is there a specific order needed for submitting the modifiers, including the degree level? So typically, they would use the HO modifier. Would they also need to include that along with the 95 and or GT modifier?
Yes, typically the GT or the modifier 95 would be in the second modifier field. So you would put your primary modifier first.
And we have another question that's similar to the question that we got about the provider being out of state, but this is sort of the opposite of that. What if the member's out of state and they had a session at a scheduled time, but the patient is outside of the state, so assuming they're outside of Massachusetts, is there any restriction on providing those services if the member is out of state telephonically?
Sure. So this is Danielle. There a majority, I think states right now have those very similar licensure waivers or emergency licensures that can be put into place. So it really depends on which state your patient is located in. The Federal State Medical Board, there's a website that actually is keeping up to date, regularly. You can click on the specific link. They have a global website, but then you can click on the specific state link that tells you exactly what those licensure waivers are looking like. So yes, in many cases, the answer would be yes, you could still do that, but there might be specific protocols for doing so. So I would refer you to that website and have you check them out individually.
And this is Rebecca with CTRC. I'm going to help Danielle out a little since I know she has no power and no Wi-Fi.
Thank you.
That web address is F as in Frank, S as in Sam, M as in Mary, B as in boy.org. It's the Federation of State Medical Boards, FSMB.org.
And I think we addressed this earlier, but just to answer this attendee's question, is telephone considered audio only telehealth? So if they were just using the telephone only, is that still considered telehealth?
If it's telephone only, it's not considered telehealth. That's audio only.
All right, seems like most of the questions that we have, and some of these we do have some sort of specific billing related questions, and again, we will be providing additional materials regarding specific billing related matters, so please be on the lookout for that. So we can't really get into a breakdown because we have folks with different plans in attendance here today. And it looks like most of these questions have been addressed in terms of a lot of the telehealth related questions that we have and specifics to equipment and so forth. So I don't know if our panel has some additional thoughts as we see if we maybe get some additional questions that filter in as we get, we're actually right at the top of the hour at 2:59, so I don't know if we want to go ahead and conclude for today and have our panelists wrap up if they have any concluding thoughts they'd like to share with the audience.
So this is Rebecca with the California Telehealth Resource Center. I would just encourage you to reach out to the Northeast Telehealth Resource Center. They're the resource center that covers Massachusetts. Should you have any additional questions, I'd also encourage you to reach out to the Beacon provider service lines and MBHP's provider service line. You know, reach out, ask questions. There is help for you available regardless of where you get it from. Just reach out.
Yes, and this is Chris. I wanted to thank everyone again for joining this seminar. It shows your commitment to our members, and we're committed to you as providers in support. So thanks again for joining. Please stay safe and please stay well.
Hang in there, everyone. Reach out, and thanks for all your hard work.
If you have ideas about future trainings, please feel free to contact us, and we'd be happy to integrate your feedback into future webinars. Thank you.
All right, thank you all for joining us today. We're going to go ahead and conclude. So I'd like to thank all of our panelists and internal Beacon employees for putting this together, and thank you all for your time and attendance this afternoon and your terrific questions and feedback. And we all here at Beacon and with the Telehealth Resource Centers and the Northeast Telehealth Resource Center and the California Telehealth Resource Center appreciate all of your hard work and dedication, and we will all get through this together. So thank you much. And please enjoy the remainder of your day and have a great weekend.
Thanks all. You too.
Thank you.